Coming up on our special program today, we're exploring one of healthcare's most universal yet deeply personal experiences, caregiving. We'll start with a medical mystery that hits close to home, then dive into the growing caregiving crisis in America, and share some extraordinary stories of love, sacrifice, and resilience.
Support for What's Health Got to Do with It is provided in part by the American Brain Foundation invests in research across the spectrum of the brain, knowing all brain diseases, disorders, and injuries are connected. There can be no cures without research. Learn how you can make a difference today at AmericanBrainFoundation.org. Rethreaded knows human trafficking destroys lives, but they also know it's not the end of the story. Rethreaded believes in the potential and power of all survivors to reclaim their lives. Visit rethreaded.com to learn more. And Elevate Med. Through mentorship, leadership development, financial literacy, a robust peer network, and tuition-based scholarship support, Elevate Med is dedicated to the next generation of diverse physician leaders as a tangible step towards the eradication of health disparities. More at elevatemed.org.
From the moment we're born to our last breath, every American embarks on a journey through the intricate maze of the healthcare system. These are their stories, one life at a time. Today, we meet Joe. Joe is a teenage boy at home doing his homework in North Louisiana, chatting with a friend on the phone, when suddenly police sirens pierce the quiet evening air. "What's going on at your house?" Joe asks his friend. "Nothing," comes the confused reply. "Why?" That's when Joe realizes the sirens are right outside his own house. Looking out the window, he sees police cars in his cul-de-sac. And there, in the middle of it all, is an elderly woman with a walker, shouting at the officers and calling them assassins in Spanish. The woman appears confused about where she is and becomes increasingly distressed when the officers try to help her. She doesn't recognize her own neighborhood, a place she's lived for years. So what do you think is happening here? What condition might explain this person's disorientation and paranoid thoughts? Hi, I'm Dr. Joe Servin, a practicing neurologist at Mayo Clinic, professor of healthcare administration and policy at Arizona State University. This is What's Health Got to Do with It, which looks at where and how healthcare intersects with your life, helping you get the medical answers you want. Now let's go back to Joe's story. If you're thinking Alzheimer's disease, you're right. The wandering, disorientation, and paranoid delusions are classic symptoms of moderate stage Alzheimer's. But here's the reveal. Joe is me. That elderly woman was my grandmother, and the person caring for her every day was my mother. That evening marked a turning point in our family's understanding of what caregiving really means. It was the first of what would become 4 difficult journeys through caregiving for me. First with my grandmother, later with my mother, my father, my mother-in-law, and my father-in-law. My family story is not unique. Today, more than 53 million Americans serve as unpaid caregivers for adult relatives or friends. Yet most caregivers receive little to no training or support. By 2030, all baby boomers will be 65 years or older, and the number of Americans needing long-term care is expected to nearly double. Family caregivers provide an estimated 34 billion hours of care annually, with an economic value of nearly $470 billion. Without them, our healthcare system would collapse. That's why we're doing this special caregiving show, and this is only the beginning of our conversation. I'm hosting an all-day caregiving workshop Saturday, August 16th at WJCT Studios. We're going to cover insurance, managing caregiver stress, and planning for the future. Most importantly, you'll connect with others who understand what you're going through. You know, over the years on this show, What's Health Got to Do with It? We've heard powerful caregiving stories. From a wife who became a nursing home dishwasher to see her husband during COVID, to a mother who learned her baby's diagnosis through a genetic study that would render her the caregiver for life. But today, we're going to turn to the everyday caregivers. Those caring for aging parents, navigating nursing homes, or coordinating care from afar. We begin with Kitty Rybar, who shared her family story of caring for her mother in a nursing home. I spoke to Kitty back in August 2024. Kitty, welcome to our program.
Thanks for allowing me the opportunity.
I am delighted to have you here, and I want to hear if you could share with us a little bit about your mom. I know you were a caregiver for your mom. Tell us a little bit about your mom and your family that have all kind of chipped in to kind of care for her.
My mom was born in 1917, and her mother and her grandmother both died on the same day in 1918 in the Spanish flu epidemic.
Oh, wow.
So she was raised by an aunt in the Cleveland area. She was originally from Detroit. She met my dad. They got married during World War II, and I have three siblings, a brother and two sisters, who all currently live in the Cleveland area. I'm in St. Augustine helping watch my two grandkids right now.
Oh, wow. That's wonderful. Kitty, what happened that led to your mom being needing care? What was the circumstance or situation that precipitated that need for care?
Well, my dad died when she was pretty young. She was 65. My dad was quite a bit older than her. And she and my dad owned a small house, and they sold the house. And after my dad died, we helped her. She was able to live on the money from the house for quite a few years. And then when her money from the house ran out, one of my sisters is a geriatric nurse.
I see.
And has really guided us through this process. We helped her apply for Medicaid. She had Social Security and a small pension from my dad's work. But we helped her apply for Medicaid, which allowed her to live in a senior housing complex that was very reasonable. And that went on for quite a number of years. When she got to be about 86, her health started failing. And we, as a group, the four of us, decided to, in effect, provide assisted living at her apartment. So she was safe to stay. They provided meals at her apartment complex, dinner, and we made frequent visits, almost daily, to make sure that she took her meds and had everything that she needed, and we supplied, whatever other little things that she needed. After a few years, 86, 88, she began to fall.
I see.
And began to get more confused. So at that point, she was hospitalized for a fall. And when she was discharged, a day later, we worked with the social worker to get home health aides into the house.
Right.
And to supplement what my sisters and my brother and I were providing. But that only lasted a couple days because she went into AFib, fell again, and wound up back in the hospital. So then we were very lucky that they were able to keep her in the hospital for 3 days, which met the Medicare requirement for her to be admitted to a rehab facility. The rehab facility was associated with the apartment complex that she had been in. It was a retirement community and had provided all levels of care.
I see.
So after a month, there was a family meeting with the social worker and the speech therapist and the physical therapist and the nursing staff. And it was decided that my mom really could not live on her own anymore. And she was very sad, and we were sad for her. We said when we left there, we felt like we were leaving our first kid at camp,
Yeah.
overnight camp. But she was a very gracious and loving and understanding person, and we kept stressing to her the need for her to be safe.
I
We
see.
were also very lucky that the facility was wonderful, gave wonderful care, and with the four of us being in town, we visited every single day. We might miss a day here and there, but we were lucky enough to show our faces. We knew the staff. It was a very wonderful opportunity for her to get the wonderful care that she needed that we really couldn't provide. We were all working at that point.
I see.
And so she was able to live there for the rest of her life. She died at 101.
Wow. Wow. And it sounds like it was a very positive, not the whole scenario, but as positive as it can be with when it comes to this issue in terms of having a nursing facility.
That's true. As I said, one of my sisters is a geriatric nurse, and she knew the facilities in the area. And we were able, through her, to be able to know that the facility that we were bringing my mom to, even starting in the apartment complex, was a good facility, would provide good care, and we were very happy with the care. We understand. I'm a nurse as well, and we understand that care can't be perfect.
Right.
I mean, there are times my mom fell out of bed a couple times. They don't use restraints unless they absolutely have to. She broke her fell and broke her arm at one point, and we understood that these things happen. It wasn't because of a lack of safety. It was because my mom was a little sprightly
Right.
and spirited. So, we worked with them, they worked with us, and it was all in all a wonderful experience. They were very sad when she passed away, as well as we were.
She sounds like a remarkable woman. Let me ask you this. I know we have featured in our previous caregiver journeys like a different approach. In that case, those individuals selected to keep the person in their home. It sounds like that just was not an option, and it sounds like it actually worked out even better. And I want to be very respectful of that. There's always more than one approach. Can you comment on that?
Um, yes, I have many friends who have done both. I have a friend who kept her mom at home, but was able to, because she was the caregiver and her mom had Medicaid, she was able to apply for reimbursement herself for her mom's needs. And she utilized her son and a friend so that she had some freedom until her mom passed away. For us, because we were all working at the time that my mom passed, and all of us had houses with steps
I
and,
see.
not areas that wouldn't be safe for someone who had some starting to have some memory difficulties. So we utilized that approach, and my sister, knowing the system well and being able to guide us, was we were all really hopeful that we wouldn't have to dig into our own savings to help her. We certainly would have if we had needed to, but we were able to work with the system, the Medicaid and the Medicare system for her care. We had a wonderful social worker, a caseworker through Medicaid, and we utilized hospice in the last couple of years of her life within the facility. And of course, we pitched in. We continued to pay her life insurance for her. We, got her a phone in her room, and we paid for that. All the extras we certainly paid for. We bought her clothes and paid for her to have her hair done and that kind of stuff. But luckily, we weren't. We were able to make use of the systems that were available and the supports that were available within our community.
Kitty, one of the things that we always ask amongst the folks who are managing on caregiving is just the emotional part of it. And we know there's a roller coaster that often comes with caregiving. Um, how did you and your family members navigate those waters?
We were lucky in that my mother was a very sweet person, and she believed us and went along with us when we told her we needed her to be safe and that we would come and see her every day. And luckily we were able to do that. I know many people are not, or there's only one child in the family or two, and that's very difficult to do, but we were blessed in that situation. My sister that's a nurse and I were a little it was a little easier for us to see her failing because we knew physically what was going on. My brother and my sister, I think my other sister had it was probably a little more difficult for them, but we all continued to go. We shared when we were sad, when we saw a little more decline, we were sad, but with with my sister that's a geriatric nurse's guidance, we entered her world.
I see.
And when she would say to us, "Where's Dad?" We would say, "Oh, he went to the races with Uncle Joe." And she would say, "Oh, that's right," because he used to take his brother to the racetrack sometimes on Saturdays. So we would say that, and we just entered her world, and it worked out for the best. It was emotionally difficult, especially in the last couple of years as she started to not recognize us, but she was still always pleasant. We
Uh,
were very blessed.
I love it. And to all of our listeners out there, you're listening to What's Health Got to Do with It on WJCT News 89.9. I'm Dr. Joe Servin, and if you're just joining us, we're talking about caregivers' journeys, and we want to hear from you. If you have an idea for future shows, tag me on X or LinkedIn at jservin. I love that theme of joining her in her world, and I'm going to remember that. Um, Let me ask one other roller coasterish thing, and this is as someone who has many siblings myself. Um, how did you navigate the sibling relationships on making decisions?
We sat down together. We were very lucky in that we all had kind of um, different strengths. My younger sister is very good with money. She worked in a business industry, and she handled a lot of my mom's financial things. My other sister, that was a geriatric nurse, guided us through the processes, and my brother was just there. He was there for my mom, and we all we did sit down and have discussions to make major decisions. And there were a few times that we disagreed with each other, but we always, just kept talking it through and really asking what would Dad want us to do? Because he and my mom had a wonderful, loving relationship, and we knew that we wanted to care for my mom not only because of who she was, but because of who our dad and how he would want us to help my mom. So we were again very lucky, and I think the four of us are pretty mature too, and that really helped.
I love how you put it, and I get that part. It sounds like you also navigated the healthcare system of skilled nursing facilities pretty adeptly. What do you think? What advice do you have for those who have a loved one in some type of home or skilled setting, in order how to best advocate and help them out so they have the best experience possible in that care setting? Any
Well,
hints?
yeah, I also worked in extended care facilities in my nursing career, and as did my other sister. So we knew that it was tough work. We knew that there couldn't be somebody to feed every single patient that needed feeding one-on-one. So we worked with that, and we tried to show up at meal times as often as we could, so that we could, help my mom and maybe help the person that was sitting next to her too. We also recognized that nothing is perfect. We did wind up asking to have her switch roommates a couple times because of different issues that came up, and the extended facility was wonderfully agreeable. And the big thing is we were there and we got to know the staff. We got to know the staff well. We brought them cookies. We brought them flowers. We knew that their job was really tough, and that my mom's care wasn't going to be perfect, but it was going to be pretty darn good.
I love these suggestions. I know you said you had a family member that was really good with money.
Yeah.
Any comments about the financial aspects of caregivings, or any tips or strategies that you all learned that would be nice for other people to know?
Well, I think the biggest one was, helping her sell her house. Again, she did not protest. She was ready to move on after my dad passed away. So that was a lucky thing. And I know that there are many families that don't have whose parents don't have that attitude. I have a good friend whose mother insisted on staying in her house, and they stayed with her and did everything they could until she started to fall. And then they said, Mom, it's a safety issue. And they just kept saying that over and over. We need you to be safe. We want you to be safe. So selling the house made a huge difference, because obviously she was able to live on that money for quite some time. And then when that ran out, we started utilizing social services as best we could. Finding out the way to get her on Medicaid, what we needed to do, and doing that a little bit ahead of time, so that when she really needed it, everything was in place. And it's not fun. You have to fill out applications every year. You have to reapply every year. You have to go through the assets and liabilities and all that kind of stuff. But working together, we were able to get it together. And again, utilizing the community services is not always easy. And you have to be persistent, because those people are very busy and hardworking as well. And so we just kept after it. And if one of us, we tried to make, like, actually my older sister, the one that's a geriatric nurse, was the health care contact for quite a while, so that they weren't having to call 4 people when if a decision needed to be made. But she would always check with us if anything was, needed input, and we were able to go from there. And like I said, we did know that we were going to have to provide some small things, and because there were 4 of us, it wasn't a big deal. Like I said, we continued to pay her life insurance. We bought her clothes. We took her out to dinner. We, brought treats. Brought our kids, brought our grandkids, and just tried to keep her involved. On every 5 years, we would have a party until she was 90. 85 was the last time that we had a party, and we actually had it there at the facility, because she wasn't willing to really go out to a restaurant or anything. But we just kept her involved.
Got it. Kitty, what's the biggest insight or surprise insight that you had over your experiences with this? Anything that comes to mind?
I think the surprise was that she lived to be 101.
Yeah.
We didn't know any of her family background, because we only had her aunt to rely on, and she died when I was a young girl. So the fact that she lived to be 101, she was actually on hospice 3 different times in the last 10 years. And they would bring her donuts and love her, and she would gain weight, and then she'd be okay for a while, and she'd go off hospice. Then she went back on hospice, and then finally at the end she stayed on for the last 6 months or so. But yeah, that was a surprise that she
She made it to 101. That's amazing.
Yeah.
Kitty, in our final moments here, what advice or other type of insights or wisdom do you want to make sure that our listeners take away from you and your family's experience with your mom that you'd like to make sure that they take away from our conversation today?
If there is more than one sibling, it really helps to not assign, but to come up together with who will take care of what aspect of mom's care. If there's only one sibling or two, then you have to do it all. But you can get help through social service agencies. I want people to know that there are many different ways. There's no right way or wrong way to take care of an elderly parent. It's what's best for the family, and coming together. Again, as I said, I was very fortunate to have mature siblings who, really wanted the best for my mom, and we were able to work through those issues. But the other thing that I would say is make use of social services. Make use of any community service that you can find. You may have to search. You may have to, do some work. Make use of your taxpayer dollars that pay for Medicare and Medicaid, and find the best way. I was going to say to keep your elder parent happy, but that's not always that's not always possible. But you have to keep them safe.
Kitty, I'm going to let that be our last word. I want to thank you so very much for sharing you and your family story. I wish we could have met your mom. She sounds like a remarkable person.
Well, again, thanks for the opportunity, and I really enjoy listening to all of your programs.
Up next, after your weekly health headlines, we continue with yet another memorable caregiving journey from our archives, and we'll be right back. Hey, it's Dr. Joe Servin. I have a new show called This Week in Health, and it's part of WJCT News Now. Local news you can listen to anytime, anywhere. When you sign up, you'll unlock 4 local podcasts delivered straight to your podcast app. I break down the week's biggest health headlines and what they mean for you. Start a free 30-day trial at wjct.org/newsnow. And if you like it, become a monthly donor to support WJCT Public Media.
Hi, I'm Stacey Bennett, producer of What's Health Got to Do with It, and these are your weekly health headlines. Recent data from the Centers for Disease Control and Prevention show that about 1 in 3 American teenagers now has prediabetes, putting them at a higher lifetime risk for developing type 2 diabetes and cardiovascular disease. The analysis, which covered thousands of U.S. adolescents and was led by CDC researchers, highlights a sharp rise in prediabetes diagnoses compared to previous years. The findings have alarmed public health officials who are calling for increased prevention efforts and early intervention to address risks among youth before they progress to more serious disease. A new wave of energy pouches, smokeless flavored caffeine packets placed between the lip and gums, is gaining traction, particularly among teens. Marketed as a convenient alternative to energy drinks, some pouches contain as much as 200 milligrams of caffeine, twice the amount recommended for adolescents. Experts warn that these products promoted on social media and linked to former Juul marketing execs may carry oral health risks, promote overuse, and mimic nicotine pouches in appearance and appeal. As teen caffeine-related ER visits rise, pediatricians urge caution. And for some good news, continuous glucose monitors, wearable devices that provide real-time blood sugar readings, are rapidly reshaping diabetes care. According to the latest guidance from the American Diabetes Association, CGMs help people with both type 1 and type 2 diabetes maintain better glucose control, experience fewer bouts of low blood sugar, and reduce the risk of complications. By alerting users to rising or falling blood sugar at any moment, CGMs allow for quick action and smarter daily health decisions. And those are your weekly health headlines.
Welcome back to our special caregiving episode of What's Health Got to Do with It? I'm Dr. Joe Servin, and now we turn to Sheila Collins in Scottsdale, Arizona, who found a different solution for her family's caregiving challenges. When we spoke with Sheila, she told us about the unique arrangements she and her sisters created, caring for their mother in her own home, who just happens to live next door. It's a creative approach that's becoming more common as families seek alternatives to traditional nursing home care while still maintaining independence and family bonds. We spoke to Sheila in June 2024 from her home in Scottsdale, Arizona. Sheila, welcome to our program.
Thank you so much.
Sheila, can you share with us a little bit about your journey, your experiences as a caregiver for your mom?
Yes. For about the last 10 years, my sisters, I'm one of four, two of us live here in Scottsdale, very near my mom, two live in the Chicago area. We provided some level of caregiving for my mom as she hit her mid-80s. But just about 3 years ago, she had a heart attack, and from that point on required 24/7 care. And that was really the pivot point for us. We made a decision as a family of daughters that she would stay in her own home, but that required a total shift in our ability to provide care. And so we found one wonderful caregiver. We found out she had a wonderful caregiver sister. We've hired them both. And then my sister and I take up the rest, which, as you have noted, ranges from 35 hours on the lesser side per week up to 60 hours per week of caregiving. It's changed my life.
Let me ask you this, Sheila. So there was four sisters, and I know this conversation well from a personal standpoint. How did that conversation look in terms of how it landed for you and your sister to be kind of more the direct caregivers, I'm assuming, or are all four caregivers just taking turns? How did you all figure out the roles in terms of who would get the lead and who wouldn't?
Well, I consider us very fortunate because all of us are in it. I know many friends who there's one person who takes the burden and perhaps the other ones sort of ignore it off to the side.
Right.
But in our case, we're all involved and do as much as we can. My two sisters who live in Chicago, they each come out one weekend a month, one long weekend a month, 4 days, and to provide a little bit of respite for my sister Kathleen and I, who live here in Scottsdale. So we're all in. We take different roles. I'm the money person, for example. Another person is the medicine and physician contact. Another one deals with other facets of mom's care. So we're all in it, and we're fortunate that there's four of us who are committed to the same goal of keeping her safe and happy.
That is fantastic. Give a sense to our listeners out there. Paint, if you can, Sheila, a typical day. What does that look like?
Well, First of all, mom is fairly cognitively intact. I think that makes a big difference.
Okay.
Obviously, if she had dementia, we might be having a different conversation.
Okay.
But she is getting increasingly forgetful, as would not be unexpected at the age of 97. She is totally helpless. On December 24th, Christmas Eve, she had a fall. Uh, After that, she was never able to walk again. So she's in a
Wow.
hospital bed in the family room. We provide all personal care from changing diapers to brushing her teeth to feeding her. And it is, as I've thought to myself, it's an honor and a privilege, but it's also frustrating and exhausting.
Okay. When you come in, is it are you the one on when it's your turn and it's up to you? Are you the one there at night, or are the caregivers there at night versus the daytime?
Well, I used to be there at night. I used to do 3 nights a week. But then I had, and I think this is a fairly common story, I had 2 injuries trying to lift her.
Oh wow.
I'm 72 years old, trying to take care of a 97-year-old. As my doctor put it, Sheila, you're fairly old, and you're trying to take care of the extremely old. I said, thank you, doctor. But it was good advice. And I realized that something had to give, that I could no longer do the nights. So my 35 to 60 hours a week at the current time is all days.
Sheila, you just made a remark a moment ago when you were describing the whole picture for us that life has changed, and my question to that is, how has your life changed? I know some of it is somewhat obvious, but give us a sense.
Yeah. It's the hardest thing I've ever done. I was a single working mom, and this is way harder. In a sense, my retirement dreams and activities have been put on hold because my main responsibility now is taking care of my mom. I also work part time as a consultant. I try to fit that in around the edges, although obviously there's limitations. So that's one part of my life that's changed. My mom is not aware of this, but she also ran out of money a year ago.
Oh dear.
And so my sisters and I fully support her and the caregivers. And in reality, that has also drained each of our savings and or opportunities to spend money on things that we or our families might like. Um, so it has changed in a very real way the way I live my life. Again, I'm not in any way saying that's not how it should be,
Right.
but it is a limitation and it has consequences.
Let me ask you, if you don't mind, what was it that drained the account? Is it the price of caregiving? Is it medical bills? Whatever you feel
Well,
comfortable sharing.
yeah, it certainly. My father died when my mother was 52.
Okay.
That is 45 years ago. And so the money my dad left for her lasted a very long time.
Yeah.
But not long enough, as we would never have thought. She with parents who were both deceased in their 50s, we never would have thought that she would have lived to 97. Much of what did drain the remaining funds was the cost of caregiving. We pay, I think, a relatively reasonable salary, but it is probably in excess of uh, $70,000 to $80,000 a year for her caregivers, and her expenses in all, totaling her house payments and or I should say she's mortgage free, but the utility bills, etc., are somewhere between 120 and $140,000 a year. And my sisters and I are now responsible for that.
Oh wow! When I hear those numbers, those are pretty significant. But I also suspect somewhat typical.
I would think so. Although in many cases, one must think of the decision that we made several years ago not to put mom in a home or in a facility. Would it be less expensive? Perhaps, but the cost of facilities that would be appropriate for somebody needing her level of care is not that different from what we're paying. So the cost of caregiving is a reality and an issue, I'm sure, for many of your listeners.
So Sheila, I guess I'm going to ask this question. I was going to say, what's the biggest challenge you faced as a caregiver? Uh, I'm assuming financial comes up there, but I don't want to answer that question for you.
The biggest challenge, Dr. Servin, is I think the emotional challenges. Um, it's hard sometimes not to feel resentful. It's hard not to feel impatient. It's hard not to feel, I wish I had more freedom. And that comes with a very complicated array of emotions because then I feel guilty. And even though I love my mom tremendously and I wouldn't make the situation different, but it is a situation where I have to give myself grace. I remember going to my Catholic priest not too long ago and at yearly confession, and I talked to him about how badly I felt when perhaps I was impatient with my mom, or I was frustrated, or even resentful. And he said, "But you keep showing up, don't you?" And I said, "Yes, I do." And he says, "And there's where the grace lies." And so I try to remember that I try to give myself some grace when I have this array of emotions.
Let me follow that up. Since that emotional piece is one of the biggest challenges, how do you prioritize self care? Knowing that you need it, but I hear you loud and clear. There may be, just for whatever reason, guilt that pops up if you're taking care of yourself, but you need to do it. How do you do it?
It's not easy. It's definitely not easy. But what I've learned is, it's not that different than when we all had little babies and the lesson everyone told you was sleep, or when the baby sleeps, don't clean the house.
Right.
Well, it's the same thing. So when another sister is taking care of mom or a caregiver is, I try to do something that feels good for me. I get monthly pedicures, for example. I try to make sure that I use that time well to call a friend for lunch. It's something to fill my buckets as well. And that really is important for all caregivers. I'm lucky that I have some respite. This is not a full 24/7 job for me, and I know for some of your listeners that may be the case. But the advice is, when you aren't providing caregiving, fill your own bucket too.
And to all of our listeners out there, you're listening to What's Health Got to Do with It on WJCT News 89.9. I'm Dr. Joe Servin, and if you're just joining us, we're talking about caregivers' journeys. If you or someone you know would like to share your caregiver story, please contact me at health@wjct.org. And if you have an idea for future shows, tag me on X or LinkedIn at jservin. Sheila, what resources or support networks have you found particularly helpful for you and your family?
Well, recently, in the last 4 or 5 months, we contacted hospice, and that has been a helpful service to us. Um, Although she's been on hospice, and although she's very frail, she has no disease process. Her blood pressure is better than any of my sisters or I's, uh, and we hope she can stay on hospice because they provide some help with supplies. A nurse comes every 2 weeks just to check vitals, make sure, particularly now that she's consigned to a hospital bed, that there aren't bed sores. And there's a social worker that also comes periodically to make sure that she and we can avail ourselves of any appropriate services. So I really encourage people to reach out. There are community resources, both medical and social. And I think, although my sisters and I provide our own little caregiver support group with the four of us, I would think that any caregiver support groups within the community might also be a helpful resource.
Sheila, one of the things I remember with my own family, because I also come from a large family, is that we all weren't always on the same page. How do you communicate effectively with your sisters and other family members or siblings about whatever's going on?
You know, we burn up the text lines, that's for sure. And we've had about every 3 months, we have a sisters video call where we sort of say, here's the situation, what's going on, how's the money lasting, what's the next phase, because we've seen her care needs increase over these past 3 years, obviously, to the situation she's in now. Um, my sisters and I are very close, but it has not been without some level of conflict and challenges. Um, those of us who are here sometimes feel like we're doing more than our share. Those who are in Chicago feel, I think, guilty that they can't be here more. One of whom is still working full time, and obviously that's a constraint. But we work hard to make our relationship also an important one because it can be very transactional. Okay, who's covering this week? Okay, uh, has the check come yet? Have you transferred money into mom's account? I need to pay the caregiver. And we have to realize that we're sisters, we're family members, and above all, mom would hate for us to be in conflict regarding her care or herself.
Sheila, have there been any unexpected rewards or positive aspects of this experience that just
Absolutely. Absolutely, Dr. Thurman. Mom, as I said, is cognitively intact, although forgetful. But the best moments, and ones that I encourage frequently, when you're there for 6 and 7 hours at a time, is for her to talk about her past.
wow.
And I've learned things about mom's childhood and about her parents, who I never got to meet because they were long deceased before I was born. And she enjoys talking about the past much more than she does about the future. And frankly, is much more in tune with that. So it is a gift to be able to encourage stories from mom, to hear about the things that made her happy when she was a child. And it's amazing the power of memory. The things she remembers from 1935 is astounding when sometimes she can't remember if she ate dinner or not. And so I think that's a reward, is the ability to learn more about mom um, in days gone past.
What what support or changes do you think you wish you had at a societal level to better support you and your family around your mom?
Well, I think uh, there's probably a long conversation that could be had about national policy for caregivers, respite care. I think should be um, something that is baked into national policy and provided free of charge. We're lucky. My sisters and I are lucky that we have some level of resources um, to be able to provide this really good level of care for mom, but not everybody does. And I think that is something that needs to be addressed on a societal level. That caregiving, as we live longer and longer, is going to become a part of many people's lives. This will be an identity that they take on probably much later in their life than they ever expected. And they need support. They need financial support, they need emotional support, and they need logistical support.
Sheila, in our last question, I wonder if you wouldn't mind providing any advice to those who are listening to the show today, to listening to our conversation, who may just be starting out in this experience themselves. What's your best advice that you wish maybe someone would have given you?
I think the best advice that I could give would be to give yourself grace. You're not going to be perfect at this. The person who you love and for whom you provide care may not like everything you're doing. You may snap, you may answer quickly, you may express frustration. It's no use feeling bad about that. It's just comes with the territory. You're doing the best you can. You're showing up. You're going to get points in heaven for this, I believe. But most of all, you are doing the best job you can, even though it may not be a perfect job. And you just have to give yourself some grace, and realize that you are an imperfect person in a challenging situation, and you're doing the best you can.
Sheila, I want to thank you so much for taking time out of your very busy calendar after listening to it to talk to us and our listeners. I wish you and your sisters Godspeed.
Thank you so much. I appreciate it.
Well, that's our program for today. We hope you've enjoyed our show. If you missed anything, you can listen to the full episode at WJCT.org and on your favorite podcast app. Thanks to all of our guests. And don't forget, join us Saturday, August 16th for our caregiving workshop right here at WJCT Studios. Our executive producer is David Luckin. Stacy Bennett is our producer. Brady Coram is our director. Caden Collins is our researcher. If you have any questions about this or any topic, let us know by calling us at 904-358-6362. Email us at health@wjct.org or tag me on social media at jservin. I'm Dr. Joe Servin, and you're listening to What's Health Got to Do With It on WJCT News 89.9 Jacksonville. Thank you for listening, and see you next Saturday, August 16th, right here in person at WJCT Studios.
Support for What's Health Got to Do With It is provided in part by the American Brain Foundation invests in research across the spectrum of the brain, knowing all brain diseases, disorders, and injuries are connected. There can be no cures without research. Learn how you can make a difference today at AmericanBrainFoundation.org. Rethreaded needs you to make a difference in the lives of human trafficking survivors. Learn more about supportive services and an array of survivor-made products at rethreaded.com. And by Neurelis, a leading neuroscience company focused on the development and commercialization of therapeutics for the treatment of epilepsy and other neurologic disorders. The company's unique drug portfolios strive to address unmet needs in patient care. Learn more at Neurelis.com.